I'll do a quick introduction before we go through this. But my name's Gemma Mackay. I'm the engagement officer, outreach and engagement for Healthy Lifestyles Gloucestershire. And I previously worked at the rugby club. You may have bumped into me on a match day. But yes, so I started in October, so I'm still quite new. But Joe is even newer. Joe, take it away.
Perfect. Thanks, Gemma. So, hi guys. I'm Joe Greedy. I am the area lead for the Gloucester and the Forest of Dean. So, like Gemma said, I'm slightly newer in post, so I came in kind of mid-November, and my goal has been kind of getting everything up and running a little bit more in Gloucester and especially in the Forest, kind of getting our services really out into the finer parts of each of those areas. So, yeah, excited to push on with that kind of work this year.
Thanks, Joe. So, my role is county-wide. So, I work with Joe and his counterparts that cover Cheltenham and Tewkesbury, and soon to have counterpart in Stroud and the Cotswolds. But yes, so let's get to it. I I'm hoping you've all heard of Healthy Lifestyles Gloucestershire before. We've been around a little while, but in April, last year, I keep needing to remember it's last year, that we were taken over by ABL Health, which is our new service provider. They won the Healthy Lifestyles Gloucestershire contract. So, in case you didn't know where we're based, we're on Eastgate Street in Eastgate House. We have a fantastic skyline of Gloucester, and I can see the Forum. So, if you ever fancy coming and visiting us for a coffee or a chat, you know where we are. Our website and our website stayed the same from the previous provider, but our contact details, so our email address and our phone numbers have all changed. So if you would like to note this down, feel free, but I can send lots of more exciting promotional materials with it on after this. Um, so just a little insight into things we do, and Joe will pick me up if I've missed anything or I'm wrong. We are a single point of access. So if, for example, a doctor referred you to our services or you wanted to refer yourself, it's exactly the same way into the service. So the best way to always get hold of us is that lovely 0800 number that was on there previously. Our lovely admin team would pick you up and then send you to the right people. If you don't hit the eligibility criteria for one of our support services, we would still arm you and not leave you empty-handed and signpost you to other organizations that would be able to help. So please, if you know anybody and you're not sure if we can help, there's no harm in calling our lovely 0800 number and finding out themselves or yourself. Following on from that is our personalized weight management support, which is what I think Joe's been doing a big piece of work on more recently. So our weight management support program is 12 weeks of face-to-face support in one of our group settings, followed by like another optional 12 weeks of a way to go program, which is a little bit more self-led, but still coming in and having a weekly chat. So these sessions are county-wide. They are personalised, of course, ever so slightly. So, for example, we do have amputees, we do have people with additional needs that come to these sessions. So the education session, for example, or the activity session is altered. Per the PARQs of the people that answered. But yeah, there's quite how many of these sessions are there across the county, Joe?
Well, now you're testing me. I think there's currently 12 set up. We're pushing forward to 15 by the end of this month, kind of into February time, and then we're hoping to raise that up to 20 by the end of this year.
Thanks, Joe. I'm just testing he's still listening. That's a little bit of our weight management support service. We also offer our smoking cessation, which is over the phone support, but for 12 weeks or up to 12 weeks if required. And we discuss NRT, which is nicotine replacement therapy, with the individuals that require the support. So this could be potentially us working with their GP to make sure that they would be eligible or able to take the new drugs such as varenicline and cysteine and all these lovely fun things that are coming into the market, but also working with them on lower level where they're just the behavioral support checkups, see how people are getting on, having that accountability. But again, this is over the phone support, and we're hoping to start a few more face-to-face sessions with this. But over the phone's been working really well so far. Following on from that, it's our kind of light touch, alcohol and physical activity behavior support. So these aren't 12 weeks, these are up to 5 weeks phone calls of just checking in, see how people are doing, some light advice. But yeah, just a little bit more than the signposting elsewhere. But these people may not be eligible for the support in our other areas. I will go into eligibility criteria on the next slide. Um, Also, a slightly newer program, which quite a lot of people aren't aware of, is our 1001 Day program. So, 1001 days is point of conception to baby's second birthday. We offer support for the parent and child and family support network around that child. So that could be working with midwives and health visitors and making sure that they've got those answered, like questions answered from anything from, I don't know, what like high chair to buy to some problems with breastfeeding, things like that. So it's a fantastic network and our team is growing on that massively, but we do attend some groups such as Homestar in the meantime to offer an additional piece of support for them. Another fantastic thing we do is our Healthy Workplace Award. So, if you haven't heard about this already, my lovely colleague Tom will be. I love that, Aaron. You're pointing at everything I'm going through. Um, so, my lovely colleague Tom may be contacting you. So, this is about kind of integrating healthy lifestyles into your work. So, that isn't necessarily us coming and bothering you every week, but that might be something your workplace feels they need. So, for example, we've been working with a couple of larger organizations more recently about some tailored support for their staffs, for example, cutting down on alcohol. It's a stressful role, therefore, they're trying to make sure that their staff don't turn to it as a coping mechanism, and that's some tailored information sessions and tailored support we're offering them. So that's the kind of thing. It works with HR, it could work with their integrated wellbeing team, just to kind of make sure that staff are feeling supported and kind of taking some of their own advice. Because I know, in, for example, care settings, we're very good at not taking our own advice. Following on from that, something again that's very new to us is the harm reduction for vaping for 12 to 17-year-olds. So this is just advice we share. We haven't done 12 weeks of support. Obviously, 12 to 17-year-olds are generally in education, so 9 to 5 phone calls isn't a best fit. But sharing information with the individuals and their families about, again, it's back to that myth busting. When people think popcorn lung is the thing, and so on and so forth. It's just sharing the information that regulated vapes are healthier if you are going to vape, and so on and so forth. So something else we do. As I've already briefly touched on, our app and online support. So we do phone calls, of course, but we do signpost people to some apps, which really great tools. And we've recently started working with the GRCC Daisy project. So those who can't necessarily afford fantastic gigabytes of data will hopefully be able to get a SIM card from us or them to be able to access the support online. And finally, community engagement. So this isn't just me name dropping myself at the end of the slide. We work with community groups that currently exist or want to exist and talk about our services, of course, but fortunately, we've been told that moving forward, so this is very new, I think we were only told the end of December, we'll be able to work with some existing groups to I guess, enhance their offer. So, for example, maybe a men in sheds group that want to add an activity element to their individuals that attend. That would be something we could potentially collaborate on, whether that be for a funding bid, whether that be just a weekly attendance. But we got the sign off that we can have more of a presence in community settings. And then to name drop myself, I love a presentation. So if you would ever like me to come to a team meeting or an organization meeting or an event, then please do pop me a message. I love it. Aaron's already had me at some job fairs, so hopefully you can attest that I'm a chatty Cathy. Um, and yeah, love promoting what we do. Um, Sorry, as I briefly mentioned earlier, so our inclusion and exclusion criteria. So you only need to be living in Gloucestershire or have a GP registered in Gloucestershire as a basic. So that's the same with workplaces, because obviously some companies have an office in Gloucester, but actually they may live in Hereford, for example, or the other side of the forest. You might be on the verge of Wales. So as long as you're GP or company in the sense of workplaces is in the county we can support. Apart from the 12 to 17 vaping support, everything is over 18. And then, of course, the pregnancy support is being pregnant. So that's nice and easy. Um, Following on for that, a little bit more in depth. So, if someone come to us and they were smoking cannabis, or taking any other drugs, for example, alongside smoking tobacco, we would have to refer them to VIA, which is Substance Misuse Charity and Support. Once they're getting that support, we can support alongside them. It's not what a one or the other. We support alongside. Following on from that, you only need to have smoked once, I believe, within a fortnight to be getting support from us to help cut down your tobacco and stop smoking. Our weight management services. So I've popped there because I will forget all the numbers because there's far too many. So generally, it's a BMI of 30 or above, unless you have a significant occurring condition or from one of those cultural backgrounds, then you're in a slightly lower area. If you are of a significant low BMI, unfortunately, again, we can't help in that sense. We are only a tier two support, so we would have to refer you elsewhere. But again, we could give you some light physical activity advice, as I mentioned briefly earlier. Reducing alcohol, excuse me. Again, it would be a referral to VIA if you were over the score of 16 on the audit tool, which basically goes from I'm drinking a little bit too much and having that awareness to a dependency. We support with the lifestyle change, the behavioral change of that around that, rather than it being used as a coping mechanism and a tool. And again, I've already touched on physical activity quite a few times, but generally, if you aren't hitting the minimal guidelines that the UK set, we can offer you some advice on that one. Um, Again, I've already mentioned this earlier, so apologies, but this is our lovely free phone number and our NHS email address. So people can refer themselves or a professional refer them. Alternatively, if GPs are a little bit more old school sometimes and they like to use a form, so that is on GCare, or you can find it via our website. Just on the top right-hand corner on our website, there's a little link to the PDF. And yeah, I sped through that. My goodness. So yeah, so if is there any questions on anything we've just said? Hopefully, if I can't answer them, Joe can, but we'll find out. No questions. Oh no, Aaron's got one. Oh no, and everybody's got one now. Francis, did you have a question?
I was just going to ask about your physical activity support. Is it all via telephone?
At the moment, it is yes. So the advice side of it, but Joe may be able to add to that one. Joe, would you say it's all telephone?
Yeah, it is at the moment. So we're working on a bit of a strategy, probably across kind of April, May time, just to look at widening that approach at the moment. At this time, anybody that's referred for physical activity essentially gets 4 weeks of phone calls to try and build their physical activity. But the one thing that we'd say is being on our weight management group, there's an exercise component to that group. So if they were through the weight management service, then they would get 12 weeks of exercise each week. If they come in for just physical activity, they only get 4 telephone based. So that's why we want to try and build that physical activity provision a little bit more. And that will probably come to light, around April, May sort of time.
And do you signpost onto existing offers in the county?
Yeah, absolutely. So we're always happy to hear about anything new that's coming about. We've got a nice big sheet of all of the things that we know about that we can signpost onto. Legacy is also a big thing that we're trying to create with the physical activity and weight management provisions. They get to the end of the 12-week or 4-week program and are very keen to carry on. So we have a nice set of things we can refer on to at the moment. But if there's anything new that comes out, we're more than happy to take that on board and signpost our clients to that as well.
I just while I remember, I didn't actually go into much detail on the weight management session. So they are 12 weeks of 1.5 hour sessions, which have a weigh-in, an education portion, and a physical activity portion. So as Joe said, there is a nice healthy balance of what's covered. And yeah, some people are really, really keen to keep the exercise going. So we do work closely with a lot of partners. For example, Fit for Life Gloss. They actually use some of the same venues as us. So we have a great relationship with them that we try and push them in that direction if and when they feel they're ready to. Were there any other questions? No? Amazing. Aaron, did you have any questions?
I'm not at this present moment in time, but no,
Great.
thank you so much for that, Gemma, and Joe as well. Really appreciate it.
Amazing.
Francis, did you say you were covering Hillary for the
I am indeed.
diabetes
Yes,
prevention
my
and
new
well-being?
I am. My new name today is Hillary. So
fantastic.
thank you for inviting the diabetes clinical program group to come in and do a little introduction to type 2 diabetes. So these are some lovely slides that Hillary has supported for us. So it's really just to give everyone a little bit of an introduction as to what diabetes is, but particularly type 2 diabetes, some of the signs and symptoms, a little bit about what people can do independently to help prevent diabetes, and the sort of offers and support that's available. Thanks, Aaron. Next slide. Thank you. So this is a really useful link. It takes you through to a very simple explanation as what diabetes is, what's happening in your digestive system, and just that diabetes type 2 can be prevented in many cases, and in some, if it's caught early, can actually be reversed. And a scary figure is actually 90% of adults have type 2 diabetes, and even more scary, a lot of people at an earlier age are developing type 2 diabetes, and that's the under 40s. So whereas it was originally thought as being a disease of older people, actually these days is a lot younger people are being diagnosed with type 2. So prevention and really seeing those early signs and symptoms is something that our clinical program group is very keen to get that message out there, is to really note those symptoms and try and do something about it. Next slide, please. So that slide's got a wee bit juggled around, but I'm sure I can still read it. So there are several reasons why people develop type 2 diabetes, and these are just a few of them, but they're the main ones. So your body weight, that is one of the key things that can indicate or lead to the development of type 2 diabetes. So if you're a little bit overweight or very much overweight, or you're in the obesity category, it's really something that you might want to look at with regards to managing that weight, maybe through our previous colleagues, through Healthy Lifestyles. Looking at your diet, looking at having a healthier diet overall is very beneficial to try and hold off that type 2 diabetes. If you've got a family history of type 2 diabetes, it may make you slightly more susceptible to developing that. So it's worth having a look and seeing what's in your family. If you are of Asian, Black African, or African Caribbean origin, you're actually at a lower body weight before you become susceptible to type 2 diabetes. Certain medication, if you're on that for a long time, could make you more susceptible. Also your blood pressure. And if you're female and have had gestational diabetes, that's diabetes when you were pregnant, you are more likely to go on to develop type 2. Next slide, please. So looking at those signs and symptoms, these are some of the very general ones that you might want to take note of. And that is if you're feeling a lot more thirsty than you would normally be, and continually thirsty, needing the toilet a lot more, passing urine, and particularly at night, needing to get up more frequently than you would do. That lethargy, so really sort of constantly feeling tired, not having much energy. Now, this one is about weight, which is the opposite. So we're saying that type 2 usually comes with a higher weight, but occasionally it could be a weight loss and a loss of muscle. Although it is less likely in type 2, it could be an early symptom. particularly itching. So itching around the genitals, and the frequency. If you perhaps get thrush quite frequently and it's becoming more frequent, that could be a sign. And also take note of the vision. So a blurred vision may just mean you need to go and get it checked out by an optician and get a regular eye test, but potentially blurred vision may have an indication for type 2. So I think it's if you really do notice either one of these or multiple signs and symptoms, is please get it checked out by your GP. Next slide, please. Thank you. So this is a handy little QR code to really think about if you think I may have diabetes, or I'm not sure, but I might have some of those earlier signs and symptoms. It's a little tool that you can go on, pop some figures in, and it might just indicate whether you may be a pre-diabetes. So you've got some signs and symptoms. You're not diabetic yet, but you're picking it up early, and that could then indicate that if you make some lifestyle changes, you may put off have that type 2 diabetes. So this was a really good tool. It's also something that our other colleagues have got something very similar in their clinical program groups. And it is really a really simple tool. Click on it, fill in the gaps, and it will give you an indication as to whether you are potentially a pre-diabetes. So catching it early is really important. Next slide, please. Okay, so thinking about diabetes and what can you do to keep yourself healthy and prevention. Have the first one. Oh, it should have some pretty pictures on this, but so generally it's healthy lifestyle, good diet, not too much of any one thing. So really looking at that balanced diet, fruit, veg, fiber. So that's a really important one. Getting exercise. A lot of us perhaps don't move as much as we should do. Just build up little and often. You can also be referred to healthy lifestyles, get some coaching, go online. Anything that you can do to just keep a little bit more physically active, a good balanced diet, and overall just think about those other healthy lifestyles: alcohol consumption, smoking, getting enough sleep. So it's what all the health advice usually is: a balanced diet and looking after yourself. Could we have the next slide, please? So just some signposting from here on, really. Your Circle is a really good platform to look at help, advice, groups. So it's a really good place to maybe get some further advice, look and see what activity options are available, diet. If you find that you've done your test, you've used that QR code on the previous couple of slides, and it's indicating that you are pre-diabetic, you may be eligible to join the National Diabetes Prevention Programme. So there's a link on there. Have a chat to your medical professional, your GP or your nurse or somebody else that you know in your GP practice. They will be able to signpost you and refer you to this programme. It's a programme all about managing that pre-diabetes stage, thinking about your healthy lifestyles, and hopefully getting into some really good healthy behaviours and preventing that diabetes type 2 from occurring. If you are diabetic, then you do need to make sure that you look after yourself, and please make sure that you do get yourself booked in for your annual diabetic review. So that's really important, to try and pick up anything early and to stay as healthy as you can with your diabetes. And finally, our last slide. So just a couple of places that you or your colleagues may want to have a look at. Diabetes UK is a charitable organisation, is an amazing website. It's got just about everything on there that you could possibly want to know about diabetes or pre-diabetes or just generally staying healthy. So I can highly recommend that one. And then we've got the online diabetes prevention program. If you are in that pre-diabetes stage, is excellent. And even NHS England has got some good information online. So there are some references there. Thank you very much for my presentation, and any questions?
Francis, I've got a question. Is type 2 diabetes, is that reversible?
In some cases, yes. If it's caught fairly early, and so you've noticed those signs and symptoms, you've gone past the pre-diabetic into type 2 diabetic. If you can really make an effort with your healthy lifestyle, your alcohol, your smoking, and particularly your weight, then it can be reversed in some cases.
Lovely, thank you.
Joe?
Oh, yeah, perfect. Thanks. I was just, I guess, interested to know whether you're kind of consistently seeing patients with diabetes, or working with maybe the diabetes team within the NHS. The reason I ask is obviously those that we deal with, a high population of those are diagnosed with diabetes. So it would be good to try and connect in some way to look if there's some kind of pathway between the two services. So yeah, I was just wondering if you directly deal with those with the diagnosis.
So our primary care colleagues obviously will see people at the pre-diagnosis stage and diabetic, and our community diabetes nursing team and nutritionists and dietetics, they see those that have been diagnosed already. So I guess it's working out where you feel you would like to be involved. Is it at that pre-diabetes stage, probably, rather than and managing once they've got diabetes?
Yeah, I think from our perspective, we'd be happy to be involved anywhere, really. I think, we'd love to be able to support, especially that team we're doing, or Gemma's leading on a project over kind of this year in terms of the connection with the PCNs and with the more clinical side of things. And I think it would be a really great opportunity especially with diabetes, for those kind of more clinical settings and clinical teams for us to build relationships there and see if there's some kind of pathway that we can build together. Because I think we can help with certainly the weight management program. We can absolutely help with diabetes or pre-diabetes. So yeah, just certainly interested in linking up in some way.
Okay, so you're probably aware that we have something called G-Care, which is a lot of information for particularly our primary care colleagues. So I think maybe at some point it would be useful to have a look at our diabetes pages and to make sure that our signposting over to healthy lifestyles is really crisp and clear for you, so that hopefully any of our clinical colleagues, if they are needing either advice on activity, weight management, then that's really clear for them to be able to contact you.
So hi everyone, so I'm Caitlin. I'm a senior project manager at NHS Gloucestershire, and one of my main focuses for the last couple of years has been on blood pressure. So I'm here with Dr. Graham Menny, who's local GP in Gloucestershire, and today we're going to talk to you about blood pressure, focusing around prevention, diagnosis and management. So this session was organised off the back of a similar session that we did for our staff internally. We're really keen to reach a broad audience with this message, as it's quite a big challenge. So nationally, there are ambitious targets around the diagnosis and treatment of blood pressure, around diagnosing 80% of the expected number of people with high blood pressure, and then treating 80% of the people with high blood pressure to target as outlined by NICE. So what that looks like for Gloucestershire, so we're estimating that in Gloucestershire there's around 160,000 people who have hypertension. We've diagnosed so far just over 105,000 of those people. So what that means is if we were to reach the 80% target, we need to find another 20,000-ish people in the county who have hypertension, but they don't know that they have it. And of the people who have been diagnosed, we've treated around 68,000, but there are still just under 17,000 people who need to be treated, and that's just for us to reach the 80% target. So there's even more who haven't been treated to the target yet. So I'm now going to hand over to Graham, who's going to talk more in detail about the prevention, diagnosis and management of blood pressure.
Thanks, Caitlin. So if we just go back to the previous slide, just for context, two main questions before I start giving the talk is, the first question for anybody listening is, how long do you want to live? And then once you work that out, of those years that you've picked to live, how many years would you accept good health and how many years would you accept bad health? Because for most of us, it's our blood pressure that will determine the answer to those two questions. So in terms of the challenge that we've been set by NHS England, if anybody's going to the rugby on Saturday, Gloucester against Leicester, Kingsholm capacity sellout is about 16,500 people. So you look at the number on the bottom, just over 16,500. So if anybody's at the rugby on Saturday, have a look around you, because that's the volume of people that we need to get diagnosed and treated to hit target. So it's a real challenge for us. Next slide, please. So there's a lot in the slide, but all you really need to look at is the bottom left-hand corner, which is about life expectancy. And you can see that in the last few years, life expectancy has been going up, but in the last few years of the slide, it starts to flatten out. And the reason that life expectancy is now flattening out is really around obesity, diabetes, coronary heart disease, and that picks up in the comments from colleagues in the previous presentations. So it's really important that if we want to live healthy lives, we need to get on top of blood pressure and lifestyle. Next slide, please. So unlike our hospital colleagues, GPs are quite simple souls. So when we look at hypertension and coronary heart disease, we think about it as ABC. Atrial fibrillation is an abnormal pulse, blood pressure, cholesterol, and actually you could add D, diabetes. So it's A, B, C, D. And if we control all those things, then we're much more likely to reduce coronary heart disease and reduce pressure on the NHS as a whole. Because as we've seen in the news over January, NHS is under huge pressure. Next slide, please. The problem that we've had is that we were doing reasonably well up until 1920. We were up just above 70% of patients with hypertension treated to target. But then COVID came along. And one of the many effects of COVID was that people weren't coming into surgeries, weren't looking after their hypertension the way that we'd like, and suddenly dropped from 70.4 down to 48.8%. And so we're on catch up now to try and get back up to the 80% target that Caitlin's mentioned. And it's really a big challenge for all of us. Next slide, please. If patients can reduce their blood pressure by 10 millimeters of mercury, so if we look at an average blood pressure of 120/80, we measure it in millimeters of mercury. If you've got high blood pressure and you can reduce it even by 10 millimeters of mercury, you can see coronary heart disease, you reduce your risk by 17%, stroke, you reduce your risk by 27%, heart failure 28%, and all-cause mortality just by reducing your blood pressure goes down by 13%. So blood pressure has a huge effect on your health. Next slide, please. So in terms of diagnosing hypertension, we'll go into the nuts and bolts of it now. Next slide, please. You can see that there's two columns here. There's the blood pressure that we take in clinic, and then there's the blood pressure we look if it's taken at home. So if a patient came to see me in clinic and their blood pressure was on 140/90 or less, I'd be giving them the usual lifestyle measure and tell them we just need to see every once or twice. I'd say once a year, depending on age. If blood pressure is between 140/90 and 179/119, we're probably looking at treatment. But we want to confirm the diagnosis. We never just go on a one-off blood pressure. So we'd offer ambulatory blood pressure measurement or home blood pressure measurement. We'd see the patient back, assess their risk, but there's a strong chance they'll be started on treatment. And then stage 3 is much more dangerous. 180/120 or more, I'd be looking to start treatment that day because you're at risk of end organ damage. So that's things like heart disease, stroke, problems with your eyes, etc. Now, if you look at the column on the right, the numbers are slightly lower. So 140/90 on the left, 135/85 on the right. And it's just that our blood pressure is always that bit lower if we're not in a healthcare scenario. So we're looking for true hypertension and not what we used to call white coat hypertension in the days when we used to wear white coats. Next slide, please. So if you were to see me in surgery and you were definitely diagnosed as hypertension after home blood pressure monitoring or ambulatory blood pressure monitoring, what would I do for you? Well, I'd check your kidneys, I'd check your liver, I'd check your lipids, and I'd check you for diabetes, because these are all things that feed into coronary heart disease. I'd also dip your urine and check your kidneys again by a urinary test, do an ECG on you, and look in the backs of your eyes to see if there's any damage to your eyes. And the last three down at the bottom are very rare, but these are medical conditions that can feed into hypertension. And it's one of those things, if you don't look, you don't find it. So it's as well to check these things at the first diagnosis of hypertension. Next slide, please. We'd also do a cardiovascular risk assessment. And this, in the electronic age, is basically we put all your numbers into an algorithm and it would come out with your risk for coronary heart disease. And it gives you a lifetime risk as well. And on the basis of that, we would decide whether you need a statin for your cholesterol and just how low we would need to get your blood pressure to reduce your risk of coronary events. Next slide, please. So in terms of what we're looking for, if BP is 140 or 90 above, ambulatory blood pressure monitoring, you put on a cuff, you keep it on for, it's normally 24 hours and it takes 14 measurements. Or home blood pressure monitoring, you would do at least 2 measurements a day, morning and evening, for over 7 days to get a definite diagnosis of hypertension. So it's really important to remember, we don't just go on a one-off reading. That is, you won't get a diagnosis of hypertension from that. We need more evidence to be absolutely sure. Next slide, please. So in terms of the management of hypertension, next slide, it feeds into what we've discussed in the previous presentations. It depends on other risk factors. So you can see on the left, if you've got diabetes, you go down one arm of the algorithm. If you go in the middle, if you're over 55, then you go into another arm. And again, depending on your ethnicity, this depends on what we would treat you with. So the drugs on the left tend to work on the kidneys. The drugs on the right tend to work directly on the blood vessels themselves. And you can see there's lots of different drugs that we can use to treat your blood pressure. And often the first one either won't work or you get side effects. We've got plenty of alternatives. So we're looking for good control without any side effects, let you get on with your activities of daily living. Next slide, please. So I'm bound by a duty of patient confidentiality. This is one of my patients. I'll just call him Jim. Now you can see Jim has not taken healthy lifestyle decisions over his life, and he's now starting to pay the consequences of that. He's obese, he smokes, so he's got chronic obstructive pulmonary disease, he's type 2 diabetic, he's got high blood pressure, he's had a heart attack, he's got atrial fibrillation, he's had a stroke in the past. Because his hypertension is not being controlled, he's got kidney disease, he's also got peripheral vascular disease, so he's got chronic leg ulcers. He's also got gout, and because he hasn't watched his weight and taken exercise, he's got arthritis as well. So this is a massive problem for Jim, but it's also a massive problem for the NHS because he needs a lot looking after. District nurses come out to see him twice a week to dress his leg ulcers. Whenever he comes to see me in surgery, he's got between 7 and 8 things he wants to discuss with me, which is tough because it's a 10-minute consultation. So by the time I've got him into the room and got him out the room, we've got about 50 seconds per thing that he wants to discuss with me. So it's real pressure for Jim and it's real pressure for the NHS. And a lot of these illnesses are potentially preventable. It all came down to the lifestyles and decisions that Jim's made over the years. Next slide, please. And you can see it's not just the illnesses he has. He spends a lot of his time taking medicines. So Ventolin and Clenil for his chest, metformin for his diabetes, atorvastatin for his cholesterol, perindopril for his blood pressure, rivaroxaban to thin his blood, Eylea for his eyes, allopurinol for his gout, and codidromol for his osteoarthritis. So again, this is a big pressure on the NHS in terms of drug spend. So really take home messages. If you look after yourself, these things are optional. It doesn't have to end this way. You don't have to be like Jim. Next slide, please. So it comes back to what colleagues have discussed. What we all need to do is eat healthily, watch our diet, take regular exercise, watch our alcohol intake, and do not smoke. And if we can do all these things, if we work together as a community to stop coronary heart disease, hypertension, heart failure, etc., our population in Gloucestershire can lead active and healthy lives. And as healthcare professionals, that's what we want. But it's a two-way street, and so we have to work with the patients and the patients have to work with us, and really we have to try and make every contact count to ensure that we do lead these lives. Next slide, please. So in terms of where can you get your blood pressure checked, a lot of community pharmacies now will offer this service. You can check on the NHS website and that will tell you where the nearest pharmacy is that will do it. We offer outreach events where you can have your blood pressure checked, and also GP surgeries. So the practice nurse will do it for you. Some GPs have a blood pressure machine in the waiting room, so you can have your blood pressure checked while you're waiting for your appointment. And at home, you can buy a blood pressure monitor yourself and check your own blood pressure. And then in the corner, there's a QR code which gives more information. So the bottom line of this talk is please get your blood pressure checked. Please take healthy decisions about your lifestyle, because it will help you and it will help the NHS. Thank you.
Thank you very much, Graham and Caitlin, as well, for that presentation. Do we have any questions at all? No? All quiet. Fantastic. Well, thank you very much for today's Lunch and Learn session. Again, this will be sent on to our Inclusivity's website. You happy for me to share the presentations with people that have been in here today?
Yep.
Fantastic. No, amazing stuff. All right, lovely. Well, enjoy your lunch, everyone. And I hope to see you again in our next Lunch and Learn session.
Thanks for organising, Aaron.
No,
Thanks
you're
a
very
lot.
welcome. Take care, everyone.
Bye-bye.
Thank you.
Cheers. Bye-bye.